Hello and welcome back. My name is Dr. Martina Assad and I am the CEO of MA Dental located on Riverside in Van Buren, California. Today we have a really interesting and important topic about children's dentistry, and I will be answering any questions any patients may have. So the very first important question, and which is, what is children's dentistry? And it all starts when the patient is actually born, when the child is born. Super important to understand to see the dentist at least for the follow-up cares and even brand new appointments. And it usually starts around 6 months old or a year old, or depending by when the patient has the first tooth. So again, children's dentistry is super important. And what it is we're probably implementing ways to help parents how to coach their kids and how to install in them how to take care of their teeth and get over the fear that they might develop later on. Why children need to establish early dentistry in a really early age. It's as simple as having habits. Developing habits, develop oral hygiene is not an easy thing. Staying away from sugar is not an easy thing. Having a good healthy diet and less snacking is also not an easy thing for parents, given that kids always gravitate toward sugar. They get afraid of the dentist and the tools. So it's super important to bring them on early on. And it's usually a very interactive and a fun visit. It has nothing to do with like open your mouth, close your mouth. We do pretty much something called a tell, show, and do. So we show the kids what we're planning on doing. We give them like goodie bags. We give them things to kind of excite them for the next visit. What is the child dental routine? It all does depend on age. So newborn to 6 months before the first teeth come in, let's make sure first of all no milk in the bottle. To when parents try to get kids milk in the bottle and then they go to bed, they can develop early cavities, which is not great, very aggressive. You can get a little gauze with clean hands or clean gloves, and then just start to massage the gums if you're a newborn. And then if the child is 6 months old or up to a year, and they should be coming to the dentist by then, so we can do our very first dental examination. When was the first dental appointment for a child? It would be at minimum when the first tooth come in, or by the age one, by year one. How do you make kids comfortable at MA Dental, especially with the very first appointment? We try to smile and welcome them. All my staff and myself were very like uptone and trying to engage children. What we're trying to do, we show them how the chair goes up and down. We get a big mirror with a big model and a toothbrush, and we have the child hold the toothbrush. Try to kind of explore with it. We show them the tools that we have. We try to keep any sharp objects away from the tray so they're not scared, like explorers and probes and whatnot. And then we kind of like ask them to open slowly, and then if we can't get x-rays, we try on a different visit. But at least we go over at least clinical observations, and we go from there. When do children lose their baby teeth? Usually they usually lose their baby teeth around possibly age 3 to 4. This era is a bit too weird. Still have 6-year-old molars, which is the first molars that come in. Some kids lose it early, some kids lose it late, but at 5 to 6 years old, we start to see at least molars come in. What do we do when a child chips a tooth? The very first thing to check is if the child has a head trauma of some sort, depending on the accident they have been in. Now, if someone bumped into their head, is different than if they fell on their face. Is different than, let's say, they tripped on like a step or something. So we need to watch out for any facial changes. Maybe palpate the face, push, and make sure that the child is not showing us any signs and signals of pain. We also watch out for the children don't necessarily speak at a young age, but they can point to a tooth, or they don't want to close, or their feeding habits are changing. Also watch out for any change in tooth color. Super important. It can turn black or gray or yellow. And then as soon as you can, seek a dentist just to check and make sure everything's okay. And then I usually advise all my trauma patients to go to the ER to check for any facial traumas, and like head CTs or MRIs, depending on how aggressive the accident was. So I really appreciate you guys listening and tuning in today. I hope I was able to answer any questions you may have about children's dentistry. If you have any further questions or you would like to be seen at our office, please feel free to call us back at 951-327-7247, and we'll be more than happy to schedule your next appointment. Thank you.